Hello everybody. On the occasion of World Spine Day, we are privileged to have our renowned neurosurgeon Dr. Amitabha Chanda.
Hello.
And our eminent orthopedic surgeon Dr. Surya Udai Singh.
Hello.
From RN Tagore Hospital, Mumbai. We all know that vertebral column encasing the spinal cord forms an important part of our system. And nowadays, problems related to the spine are rampant in our society, both for the young and old. And there are many questions which arise in the minds of common people. We will try to find the answers to this from our consultants. Sir, nowadays, as we all know, because of aging, there are degenerative changes in the spine. So there was a problem of pain over the low back as well, and sometimes over the neck as well in the elderly age group. And because of professional hazards like bending over the desk or sitting at the computer for a prolonged time or lifting heavy weights, these sorts of pain and other spinal problems are quite common in the younger age group also nowadays. So how do we approach such a patient? What are the criteria when these people would seek a neurosurgeon's or an orthopedician's opinion?
That's a good question, but before the patient lands up in with the orthopedic surgeon or a neurosurgeon, I would really encourage them to do some preventive measures so that they don't land up with the orthopedic surgeon or neurosurgeon and end up in having a surgery. As you have said that spine encases the spinal cord, which is so important structure in our body. It's a pile of stack of bones made of spine which encases the spinal cord. So it bears we are two-legged animals. So spine bears the axial load. As we go down the spine, the amount of load increases. It bears the weight of the body, and it's a mechanical device. So as you put more and more load, there will be degeneration. There will be wear and tear. Like we have in knees, we have in there's changes or arthritic changes in the hips. So spine is also composed of multiple joints, and it will have this kind of wear and tear, which we call degeneration. So how to prevent this degeneration, or at least nobody can prevent as such, but we can delay the degeneration just to reduce the body weight and make some parallel weight bearing device, which are the muscles. So reduce weight and do regular exercises to build up the muscles, so that will bear the weight of our body and relieve the spine. And as you are saying that professional hazard, people are working for prolonged period of time in office, so correcting the postures. So these are the three very basic things we can do to delay the progress of the degenerative disease or spondylosis.
Sir?
Okay, my regards to Dr. Chanda. As you know, when I came here, he was my teacher for the spine surgery. So my regards to you, sir, again.
Thank you.
I'm sitting beside you. That's my pleasure. So I can simplify your question. When to consult to a neurosurgeon or orthopedic surgeon? There is a big dilemma. For the spine, whether neurosurgeon is good or orthopedic surgeon is good. No. There are certain indications where you have to go for the neurosurgeon. There are certain things when you have to go for the orthopedic surgeon.
Then how
Simple.
common people realize?
Yes. If you have simply neck pain or back pain, restricted to that area only, so you need to consult orthopedic surgeon.
Fine.
Second thing, suppose you had a back pain, I am using the medical word, radiating to either of the leg or both of the leg, or you had a neck pain radiating to either right upper limb or left upper limb, so you have to consult neurosurgeon. There is one more thing that is called as a referred pain. Suppose you have a back pain and going to the both of the hips, buttock region, then again you have to consult neurosurgeon, because that may be the case of spondylolysis or listhesis. That is called as the referred pain only. Here general viewers are there, so even for the doctors also, whenever you go for the back pain, always look for the hip, as Dr. Chanda said. Always you have to look for the hip, otherwise you might miss. Sometimes back pain and hip pain mix. So if you go to the orthopedic surgeon, does not matter. What I said, when you have to go neurosurgeon directly, even if you go to the orthopedic surgeon, they will refer you if there is any radiculopathy or referred pain, and they should refer.
Thank you, sir. Then I wish to know, there are different types of pain, as you mentioned, in different age groups. Some of the pain are of sudden onset, some are chronic, some are subacute, some are relapsing remitting type. So what are the main causes of pain in the spine? If you can throw some light on it.
As you were saying, that acute pain, it starts suddenly, sudden acute pain in the back or in the neck. In the back, especially in elderly people, I would seriously think of some extra spinal causes that has to be ruled out, like there is a big vessel in the abdomen called aorta. If there is a rupture aortic aneurysm or something like that, that is very dangerous and life-threatening. It's an emergency, but it's a non-spine cause that has to be considered, always has to be considered. But the most common cause of acute pain in the back due to spine or the surrounding structures like muscles is a muscle injury, muscle strain. That's the commonest cause of acute pain. Only localized to back, not to limbs, as Dr. Singh was saying, that if there is sudden pain in the back radiating to the legs or radiating to the arms, that could be due to acute slip disc, what we in common people say. It's a slip disc which is pressing the nerve. He was mentioning that if it radiates to the arms or the legs, it means that it is pressing the nerve. That's why you come to the neurosurgeon. Or if it presses the spinal cord, there can be weakness of the legs and weakness of the arms. So this is the commonest cause of acute pain, and then slip disc, sudden slip disc can cause acute pain in the back. And chronic pain, like if it's a slip disc or degenerative changes, a spondylolisthesis, a spondylosis, as he was mentioning, or maybe some non-spinal causes can also give rise to chronic back pain. These are the common causes, and very dangerous causes are spinal tumors and spinal infections. But the hallmark difference between the degenerative spine pain and pain due to tumor or infection are that the patients will have night pain. Night pain, yeah. The patient who is, the pain will wake up from the sleep. Usually in degenerative pain, the bed rest relieves the pain. At least it reduces the pain. But in tumor or infection, the pain will increase. I have seen patients that they say that they can't sleep. Whenever they sleep, the pain increases. The patient had giant cell tumor. Dr. Singh will remember several years back, we operated on one gentleman with giant cell tumor of the cervical spine. The patient said that he couldn't sleep because whenever he is taking bed rest, the pain is increasing. So these are the things which has to be remembered.
Do you expect patients with infection or such mitotic lesions to be associated with other constitutional symptoms?
Yes, like in infection tumor, both can have fevers. If there is cord compression or root compression, there could be radiating pain or weakness of the limbs. This all can happen.
So we will anticipate a tumor or a malignancy, or rather it can be a benign tumor also, some mitotic lesion. In which age group?
There are some kinds of tumor which can affect in any age group. Metastatic lesions usually occurs in elderly people. Infective causes like tuberculosis, pyogenic infection can occur in any age.
Sir, in elderly people, due to degenerative process, there are often changes in shape of spine. There are scoliosis, lordosis, and osteoarthritic changes. Though they are not life-threatening, but sometimes they are quite debilitating and very difficult. It's very difficult for the victim to carry out day-to-day activities. So what do you advocate in case of such patients, and how do you weigh the risks and benefits of surgery in case of elderly patients?
Okay, I will come to this question later on. I will just point out one thing which you asked earlier. Dr. Chanda told, I think, everything very clearly, but I want to add one thing. Suppose you might have the acute pain, maybe in the morning. You got up in the morning, you might have a very stiff neck. You might have the stiff back. Don't panic. It might be simply you must have overslept in a single posture. Deep sleep sometimes causes the acute neck pain or back pain.
Does it cause muscle cramps, muscle spasm?
Muscle spasm, because of the muscle spasm. So that is one of the reason also. Mostly we all, I think, have felt that if I had a deep sleep in the night, we might have the pain in the neck or back. Now you asked that the osteoporosis, and what else was? Osteoarthritis.
And the changes in position of spine, like scoliosis.
Okay, scoliosis. Okay, osteoarthritis, what Dr. Chanda said, the spine is the similar joint as the knee joint and our hip joint. So osteoarthritis of the spine is called as the spondylitis. Simply, there is a different term, but if we used to refer, okay, spondylitis means we are talking about the osteoarthritis of the spinal joints. So it should be treated the way we treat our knee osteoarthritis or hip osteoarthritis. Some medications, because this is also a synovial joint. So medication and exercise, these two things. Now I am coming to the scoliosis or some deformity of the spine. Kyphosis or scoliosis. If you talk about the elderly people, the main reason is this deformity may be congenital. Definitely, if it is congenital, somebody must have seen or somebody must have treated that patient. But I am talking about the elderly only. They may also develop that scoliosis or kyphosis. Even they might not have earlier in the childhood. The one group of the patient will have that deformity from the beginning of their life, and another group of the patient they might develop later on. So main reason for that is lack of the physical exercise, that is muscle balancing. That is most important thing. If you are not balancing your muscles, if you are not strengthening your muscles, then you will have that problem. The second thing is the osteoporosis. If your bones are weak and your posture is not good, what Dr. Chanda said, your posture is very important. You have to maintain that. If you had a bad posture, if you had a weak bone, if your muscles are not toned and you don't do exercises regularly, then you will definitely have these two problems, scoliosis or kyphosis.
So would you advocate regular exercises?
That is always, even on this spine day, my message only, there are three things. You have to exercise, you have to hydrate yourself, and you have to take the adequate diet. Why I am saying diet? Whatever we give the supplement, suppose calcium, what we give for the osteoporosis, if you take a proper diet, then you don't need any tablets. But anyway, suppose you can calculate your diets, how much calcium you are taking and what is your need. Even if you cannot take from your diet because of certain reasons, then you may have the tablets and you may check it regularly whether you are having osteopenia or osteoporosis or not. So if you take care, what the Dr. Chanda said, first line, preventive care. We can prevent all these things.
And the importance of hydrating is cannot be overemphasized, because as I've told that spine is just a stack of bones, and in between the bones we have disc. Disc is a jelly-like material. This acts as a shock absorber. We jump so that the bone doesn't rub against each other, doesn't hit against each other. So if we hydrate ourselves well, the jelly remains jelly. If the jelly dries up, then the gap between the bones decreases, and there is more chance of the bones hitting against each other and causing aggravating the degenerative changes. That's the importance of hydration in preventing spinal disorders. And as for surgical things, means for lay people, for non-medical people, they must know that there are some red flag signs. Means they must attend a specialist, either an orthopedic surgeon or a neurosurgeon. Orthopedic surgeon, like Dr. Singh, he is trained in spine surgery. Not all orthopedic surgeons are trained in spine
Actually,
surgery.
Sir, in general, we have seen people are very apprehensive about spinal surgery, and somehow they have a misconception that after that they won't be able to walk and things like
No, it's completely wrong conception that after spine surgery, if it is properly selected, if we operate on patients who really needs operation, the results of surgery is excellent. The result of surgery is excellent, I will say.
So how do you choose patients who really need operation, and in which
I was
cases do you go
exactly
for
coming to
consultation?
that. When you should call a neurosurgeon, an orthopedic surgeon, a spine specialist, who operates. First, the pain, which is not at all getting relieved by rest. Have bed rest for 2-3 days, it is not coming down at all. You need to see a specialist, a neurosurgeon or an orthopedic surgeon.
Irrespective of the age.
Irrespective of the age. But if it is a muscle strain or a degenerative change, the pain has to go down after 2-3 days bed rest. There is no point in prolonging the bed rest. If there should be some amount of relief. Means maybe it was in pain score, it is 10 out of 10, but after 2 to 3 days it should come down to like 6 or 5, like that. It might not be 0, but at least it could come down. Second thing, if there is any radiating pain which is not getting relieved, as he was mentioning, that radiating to the legs, radiating to the arms. 3, if there is any tingling, numbness or weakness of the limbs, you must visit a specialist. If there is an urinary incontinence or urinary hesitancy, you cannot pass it, you're difficult in passing urine. Or if there is lack of sensation around your buttock. So these are very important and warning signs that you must see a specialist, and investigations might point that you might need some surgical treatment. And the surgical treatments have advanced so much that I can assure everybody that in most cases the results of spine surgery are excellent.
One more thing I wanted to ask you, in which situations there is a tendency among people that there is a bit of giddiness, and somebody advises them that probably this is due to spondylosis, and without any medical advice they tend to put on a cervical collar. So in which cases a collar is indicated and which cases it is contraindicated?
Look, so far best of my knowledge goes, cervical spondylosis almost never causes giddiness.
Exactly.
Almost
Mostly
never
from the
causes.
ear.
Mostly from the ear.
Surgery.
Exactly so. The cervical spondylosis causing vertigo or giddiness is almost unknown. It has been disproved long back. But what happens that patients, aged patients like 50s or 60s will have experienced, and there will be some degenerative changes. So they tend to think that cervical spondylosis is causing this kind of dizziness or giddiness or vertigo, but it almost never happens. Using collar for prolonged period of time is contraindicated because it will weaken the muscle further, or belt or collar for long period of time. A lumbosacral belt gives mainly psychological advantage, that I am having some kind of support in my back. A lumbosacral belt cannot stabilize the spine, cannot. It is so heavy, the spine is so heavy, it cannot get support from that lumbosacral brace. For acute pain, for comfort, you can use for a few days. In some post-operative patients, we might need this brace in cervical spine or in the lumbar spine. But by and large, the use of collar or brace for prolonged period of time is getting obsolete these days. what Dr. Singh will say. Do you agree?
Yes, no, I can summarize few things for the public what Dr. Chanda said. If you had any problem, suppose nobody should get afraid of the spine surgery. But the only thing, who will operate? Neurosurgeon or orthopedic surgeon? All the neurosurgeons don't operate spine. All the orthopedic surgeons don't operate the spine. So what you have to ask? You have to ask whether that particular neuro or ortho is doing spine or not.
Regularly.
So you can say yes, he is spine specialist or spine surgeon. As I was orthopedic surgeon only when I came here, Dr. Chanda told me how to operate spine. So I got interested. He firstly he called me in his surgery to assist. So I got little bit of interest. Then he teach me how to operate, and then I started to operate.
And you got training on spine as well. So
then after that interest, I got the training on the spine because I generated my interest. But by born I was orthopedic surgeon, but I was not the spine surgeon. That is the first thing. So for the public, you don't need to rush for the neurosurgeon or orthopedic surgeon. You have to rush for the whether that particular neurosurgeon or that particular orthopedic surgeon does the spine or not. That's all. Spine specialist, you need to look for that. Second thing, regarding the your vertigo and spondylitis, cervical spondylitis. I can say only one thing, what Dr. Chanda said, cervical spondylitis does not cause the vertigo. But you have to look for the carotid arteries, because the carotid arteries goes through that cervical spine. So you can do the carotid Doppler. If it comes normal, then you just forget that that cervical spondylitis is causing that vertigo. But
whether there is any vertebral insufficiency.
Yes. So you have to look for the vertebral artery always.
But again, vertebral artery insufficiency will cause only vertigo is very unlikely. It will have other symptoms too. Not syncope. It will have some kind of momentary, say, numbness of the body or something like that. Look, if there is a vertebral artery compression, it will selectively cause vestibular insufficiency, is very unlikely. It will involve some part of the brainstem, right? So either some weakness or some numbness, something like that.
Okay, and now I am coming to the what people generally do and ask, whether we should take the LS belt or cervical collar. Please, no. It's a big no. Because you are taking some help or ad from some other side. You are taking a ad. You are taking a walking stick. Don't do that. What Dr. Chanda said, contraindicated. Yes, it's contraindicated. That will weaken your muscles. This is the external support. You have to generate your internal support. You cannot survive long for the external support. Okay, you have to drink water. You cannot have every time saline in your veins. You have to drink your water naturally. So if somebody is using, try to avoid it. The only mean to avoid that is the exercise.
Absolutely.
You have to avoid that. Maybe for 7-10 days, if you are comfortable with that, it's okay, but not beyond that.
So one more thing, when an accident occurs and the neck is injured, then we get patients with quadriparesis. One thing I wanted to ask you.
Quadriparesis means, for the audience, it's a weakness of all four limbs. Yeah.
One thing I wanted to ask you, suppose an accident has occurred on the road and some good Samaritan has rushed to help the victim. Can you give us any suggestions for the common people how to handle the victim in case a cervical injury is suspected, so that the chances of nerve injury is minimized on the road?
Look, it is very difficult to teach the population at large how to take care of the spine in a trauma patient. So, but for a thumb rule, I can say that don't try to manipulate the head or the neck. Preferably, if possible, just ask for help. You alone cannot lift up one adult patient and bring him or her to the hospital. So ask for help. So give a good support to the neck and the head, and make sure that there is no twisting of the neck or head. That much I can communicate to the non-medical people who are not trained in basic life support.
Cases of fall from a height also.
Right. Yeah. So no, I'm talking of how the common people should take care of. They should ask for help. they alone cannot do that, especially in a patient who is unconscious or complaining of severe neck pain or back pain. So that has to be always remembered. That much I can say. And I will encourage common people to learn basic life support, so that can save a lot of lives actually.
Sir, what are the basic investigations we undergo for neurosurgery before we undergo any neurosurgical intervention?
Usually means first see whether any surgery is needed at all. Sometimes patient come with back pain, both to him and me. We see it's a muscle strain, just give 2 days bed rest or 3 days bed rest and pain goes away. So it's not that any patient coming with kind of back pain, acute back pain, ask for an MRI or a CT scan like that. If the pain doesn't go away in 2-3 days time, then I will get an X-ray, only if it's only back pain. And if the X-ray doesn't show much, then maybe I will put him on some medications and some rehabilitation. If it doesn't,
And when is an MRI indicated?
the red flag signs are absolute indication for MRI, and if the pain is not going away, then we should get an MRI.
Sir, can you throw some light on congenital malformations of the spine?
I think Dr. Chanda can tell better about the congenital malformation of the spine, but I want to say one thing, what you asked earlier, how to transport the patient. For the public, I think we are going live, so many of the people will see this video. Just few simple tips. Suppose any trauma victim, how to hold it. You have to put your both the, suppose what he said, you cannot do it alone. You need at least 2 or 3 people. One is supporting the leg, one is supporting maybe the trunk, and one has to support the head and shoulders. So what you can do, you can put your both hands on the armpits. Okay, hold it like that with both the shoulders, and try to rest that your head between your both the forearms here. Don't move it, just you move around. You have fixed your hands, make it straight, and your head is resting here, so it will not move. Okay, so you can prevent the further cervical injuries. This is very simple tips. Otherwise, if you had something to strap it, to stabilize it, it's okay. If you don't have anything, then put your both the arms in the armpit shoulders and make it straight and rest here. That will be the sufficient. That is the first thing. When you go to the, suppose you are transporting the patient over the seat, maybe some vehicle, so you have to put something behind your head, because your shoulders, there is a gap between your back of the head and back your proper back. So if you put him straight, then neck will be like this. You have to give little bit of support, this much. Okay, if the patient is on side, then you have to measure the difference between the shoulder and here. So you have to give this much of the rest. Okay, if you have one pillow small, then you can put it back. If you have 2 more pillows, then you put it on side, here to here, and wind it up, so you can transport the patient easily. So this is for the public. Even we can you can learn it repeated, because we face the accidents, and what the accidents does the trauma, we do more during the transportation, because we don't have that. Yes, we don't have that.
Because of mishandling, there is more injury. How can you prevent it?
So I think congenital malformation, I will refer to Dr. Chanda.
Congenital malformations, I think it's a separate huge topic, and it will be too long in this short session, but some congenital malformation manifest at the time of the birth, like in the gap in the spine, the big hole in the back of the child. Sometimes the fluid leaks through the gap. In those cases, it's an image defect. Sometimes the defect is not very obvious, which shows up later by developing weakness of the limbs, lower limbs, or urinary problems. And a big thing which can come up later, as you were mentioning, that scoliosis. In congenital scoliosis and then adolescent scoliosis. Again, it's a very big topic, and when to operate, when not to operate, when to. It's correctable. It's surgically correctable. Both are surgically correctable, but it's a formidable surgery. It's not a very easy surgery. Unless you are really trained in that, I would say don't venture it. So that's it.
Sir, anything else you would like to?
I would say a few things. First thing is to prevent. Since the tumor, I am not going to tumor infection. Commonest problem is the degenerative changes, what you call slip disc, spondylosis, and these things. So try to delay the onset and progress of this disease. So have plenty of water, reduce weight, do exercise to develop muscles, good muscles to support the back. And if you develop these degenerative changes, most of the degenerative changes can be managed without surgery, with some kind of rehabilitation or medication or some injections, pain management. This can be managed. Only a small proportion will need surgery, but be assured that the results of surgery is excellent. Don't have to get scared of surgery. It's not that if you come to a surgeon, he will always advise surgery. There are surgeons who will not advise surgery if you do not need it. But if you really do need it, get yourself operated, and trust me, the results of operation are excellent.
So my message is, an apple cannot keep you away from the doctor. Have an apple, take a lot of water, and do the exercises. You have to add 2 more things with the apple: exercise and water. So my best wishes. I think you all got the message. Do the exercise, have a lot of water for the hydration, and have a proper diet. Thank you.
Thank you very much.